Hi, I'm Camille from Pareto Education and welcome to our YouTube channel. Today I'll be speaking about polyuria. Be sure to like, subscribe and click that bell icon for more awesome content. Polyuria refers to an excessive urine output, typically defined as more than 3 litres per day in adults. It is an important symptom to assess as it can indicate a range of underlying conditions, from common metabolic disorders to more serious endocrine disease. You should be comfortable in taking a polyuria history as it is a common OSCE station and a frequent presentation in both primary and secondary care settings. When taking a polyuria history, consider the following causes. Firstly, endocrine causes such as diabetes mellitus, one of the most common causes. Diabetes insipidus. Renal causes can include chronic kidney disease and diuretic uses. Psychogenic causes do include primary polydipsia. Medications that can cause polyuria include diuretics, lithium, and corticosteroids. Finally, consider an electrolyte abnormality such as hypercalcemia or hypokalemia, which can also cause a polyuria. When taking a polyuria history, be sure to explore the following themes: onset and duration of symptoms, any symptoms related to polydipsia, excessive thirst. This can suggest diabetes. If a patient is frequently getting up at night to urinate, nocturia. If a patient has significant weight loss, again, another sign of uncontrolled diabetes. Thinking about diabetes, you can also consider diabetic emergencies such as diabetic ketoacidosis if the patient is unwell. Neurological symptoms such as confusion or lethargy, which can indicate electrolyte imbalances. Assessing polyuria properly is crucial for identifying this cause and managing it effectively. So let's see an example in action. Hi, my name is Camille. I'm one of the advanced care practitioners at the GP surgery. Can I start by taking your name and age, please?
Yeah, I'm John Smith and I'm 54 years old.
Nice to meet you, Mr. Smith.
Nice to meet you too.
How can I help you today?
Well, I've noticed that I've been going to the toilet a lot more.
All right. So tell me a little bit more about that. Is that to pass urine or open your bowels?
To pass urine. So I would say this has been going on for the past few months. As opposed to going maybe 3 or 4 times a day, I end up going every maybe 2 hours.
Well, that's quite a bit more than usual, you'd say.
I mean, it's very disruptive for me, as you can imagine. I'm always having to get up and go to the toilet. It can be quite embarrassing.
Of course.
In fact, I've even noticed that I'm going in the night as well.
Oh, really? Yeah, that can disrupt your sleep. So tell me about when you go to the toilet, are you passing the similar amounts of urine or less or more so?
I think I'm probably passing the same amount, but because I'm going a lot more, I guess in total I'm passing more urine.
Okay. And when you go to the toilet, is there any problems such as, do you have any pain when you're passing the urine?
No, there's no pain.
Any strong smells associated with the urine?
Not that I've smelt.
Is the urine different color, darker, or anything like that? Any redness to the urine?
Definitely no redness. It just looks like urine.
Okay. And when you first go to the toilet and you want to pass urine, do you find that it's difficult to get started? We call this hesitancy.
No, it seems to come out okay.
And is the flow, a lot of personal questions around this area, but is the flow sort of regular, or do you have any dribbling, anything like that?
Definitely no dribbling. It seems to be as normal.
Okay. And have you had any prostate issues in the past?
No, never.
Okay. So what about in yourself? I'll ask a bit more symptoms around this area, so try and get to the bottom of this for you.
Thank you.
Okay. When you're passing urine, have you felt any abdominal pain, anything?
No, tummy seems to be absolutely okay.
Okay. Any fevers?
No.
Right. And some of the more generic questions, are you feeling, in terms of yourself, do you feel more thirsty or are you drinking more water?
I mean, I have to say, I feel so much more thirsty. I'm drinking a lot more water. Not because, I know it's good to drink a lot of water, but I just feel the constant need to drink.
And do these sort of correlate about the same time that your urine problems started?
No doubt, they pretty much come together.
And since this period, you've said a couple of months, has it been getting better, the same, worse?
Probably worse.
And what is particularly highlighted you to come in today? Is there a particular concern that sort of said, I need to seek help today?
Yeah, it's become really disruptive. I've also noticed that I'm losing weight, and I don't know if that's of concern.
Definitely. We'll definitely check into that. Yeah, it's good that you've told me about that. That's one of the symptoms that we actually look out for. Okay. Have you experienced any, this weight loss that you've described? Do you know how much you've lost?
Not really, but I know I've gone, it's just subjectively. My wife keeps telling me that I've lost a bit of weight. But the weird thing is that I'm still eating the same and I'm exercising. So
That would have been my next question, what about your diet and lifestyle? But it looks like you're still doing everything the same.
yeah, absolutely.
Okay. So that's a bit more concerning really, because we want to tie down why exactly you're losing weight.
I mean, I'm eating, just to add, I'm eating absolutely fine.
Okay. Have you noticed any other symptoms such as fevers?
No fevers.
No?
No.
Any pins and needles in your legs?
No.
Your fingers, anything like that?
Nothing like that, no. Legs fine.
Any episodes of weakness?
No, legs and arms and everything seems to be working fine.
Any dizziness, anything like that?
No.
And have you had any periods where you've had a faint or anything?
No fainting.
Okay. Have you started any new medication in the past couple of months that may have been related to this?
Well, I've got high blood pressure and I'm on, I think, amlodipine. And that seems to be how it always is. I've been on the same dose for maybe about 3 or 4 years. But yeah, nothing new really.
Okay, so nothing new over the counter?
No.
And is that the only medical condition?
Yes, yeah.
And how is that? Is it relatively stable? Yeah?
Yeah.
Do you check at home?
I do, yeah. I think every couple of months they ask me to check, so I just put it on and check.
Any recent surgeries, anything like that?
No recent surgeries.
Any foreign travel?
No, none at all.
Okay. Any medical problems that run in the family?
Well, not really. I mean, I know my brother is diabetic.
Okay.
And my mother, who's no longer here, she was also, I think, pre-diabetic or kind of, yeah. That's about it, to be honest.
And is your brother type 1 or type 2 diabetic? Do you know?
I don't know.
Does he inject insulin or you would?
No, he's on tablets from what I understand.
Okay, brilliant. And in yourself, is there any family history of anything else?
No, family's not all right, actually.
Okay, brilliant. And tell me about yourself. So do you work currently?
I do, yeah, I work.
What is it you work?
So I work as an admin clerk in an eye unit.
Okay, and how's that job? Is it stressful? Is it, you managing okay?
I mean, it's okay. You kind of get your ways to do things, isn't it?
Yeah.
So I think I've got a bit of control over my schedule.
Perfect. Do you smoke at all?
I do, yeah, I do.
How many days smoke?
So for age, probably about 20 a day.
20 a day. And how long have you been smoking?
Quite a few years, probably about 2 decades at least.
Okay. And what about alcohol intake?
Not much, just, a couple of drinks on the weekend.
Fine.
That's it.
And you mentioned that in terms of your lifestyle, you've not really changed your diet or exercise regime. Are you normally sedentary, active?
Probably not very active. It's just busy, you get home from work, get really tired and just want to kick back with a movie or a TV series, really.
All right, okay. So what kind of things do you normally eat and drink on a typical evening or lunch?
I'll be honest with you, my diet's not very good. I don't eat many greens and I don't eat much veg. And a lot of it is kind of ready meals just because I live alone. So, and I'm not the greatest cook. Yeah. So I just kind of make do with whatever's around and whatever's available. But yeah, those are my kink in my armor, really.
Okay. So let's do a few tests to find out what this is.
I mean, what do you think I might have?
Well, from the sounds of things, your symptoms such as passing excessive urine, feeling thirsty, a bit of weight loss. I want to investigate you for a few things.
Okay.
We'll start with the routine observations. I'll do your blood pressure and things like that. I'd like to do a few blood tests.
Sure.
Check for full blood count, anemia, kidney and urine function.
Okay.
Check your electrolytes as well. Potassium, calcium, etc. Like to check your thyroid and also like to check for risk factors. You've got a few of them for diabetes.
I obviously did a bit of reading and I think, does it sound like I've diabetes?
Potentially, I mean, it could be diabetes. It's one of the things these kind of symptoms are common with. I'm not saying you do, but it's one of the things that we should check.
Okay.
And once we've got the results of those, we can discuss in further detail.
I'm in your hands.
Yeah. So we like to do those, and in the meantime, I'll give you some safety netting advice. If you feel more unwell in yourself, if you feel like your blood sugars, if you feel like your energy levels are up and down, then at that moment you should seek further medical advice. Okay?
Okay, no problems.
Okay, so thank you for your time. Do you have any more questions?
No, none at all. You've been very good. Thank you so much.
Okay, thank you.